Medical rounds. Did you know that epilepsy is the fourth leading neurological disorder in the United States? That's why the month of November is dedicated to creating awareness. And just 1 year ago this month, Hartford Hospital opened a new comprehensive epilepsy center to address the need locally and to treat patients with this disorder. And joining us live now from Hartford Hospital is Dr. Schuyler. We thank you for being with us tonight, Dr. Schuyler.
Thank you for having me.
Well, tell us, how has the first year been in treating patients at the Epilepsy Center?
We have had a very successful year. We have been able to treat many patients with medications and other options and help them to become seizure-free. For some of our patients who we are not able to control their seizures with medications, we've been able to make adjustments to help them feel better. We've been able to provide psychological and social service support for our patients. And in cases where somebody may have a surgical option, we've been able to provide them an option that can cure their seizures.
That's good to hear. And I know we're looking at some video now of a monitoring unit, a 24-hour monitoring unit. That must be incredibly helpful.
It's given us a great opportunity. In some cases, patients, when they describe what's happening to them, we're not able to tell by description or the testing that is done routinely whether or not what they're experiencing is seizures or not. And in that case, we can electively admit patients to our state-of-the-art unit and record the symptoms that they have at home and give them a definitive diagnosis. Now, for some other patients where we're not able to get their seizures under control with medication, we can admit patients to our unit, record their seizures, and look to see if there are other options for treatment, such as surgery.
Dr. Schuyler, we have time for one last quick question. How easily, you mentioned diagnosis, how easily is epilepsy diagnosed? Are the symptoms fairly typical, or can this be a tricky diagnosis?
It really can be a tricky diagnosis. In some cases, it is more straightforward, and with tests such as blood work, MRI of the brain, and an EEG test, we can have a pretty good idea of what's going on. But for other patients, it really does require more depth and an admission to our unit.
Well, good to hear. And when you're a patient, when in doubt, get it checked out. We thank you so much, Dr. Schuyler, for being on our program tonight. And if you'd like to learn more about epilepsy, there is a free class on Tuesday, November 19th at 6 p.m. at Hartford Hospital Family Health Center in South Windsor. And for more information, you can call the number you see on the screen there, 860-545-1888. And if you have questions right now, this is a great opportunity. Dr. Schuyler is available to answer them online. All you have to do is log on to WFSB.com.